here and for you all to have for your records as well to reflect on. So to give a little bit of a session overview, the purpose of these meetings is to strengthen our relationships and grow understanding about the nutrition systems that the SPAN plan seeks to influence across the state of Georgia. So we have a few goals. We talked about this in session 1, but those goals are really to connect and reconnect with other members of the Georgia community, other organizations and persons vested in nutrition policy systems and environmental change in Georgia. We want to grow understanding of this GSPAN project and what those priority deliverables are. We want to describe parts of the system, nutrition system, that are influencing nutrition in Georgia through whole systems mapping and the systems iceberg exercise that we'll be participating in today. We want to define key indicators to inform the GSPAN evaluation plan. We'll talk a little bit about that towards the end of the session today. And we really want to prepare for this statewide systems convening that we'll be hosting on April 29th and 30th. Next slide, Jimmy. So if you'll recall, our agenda for our previous systems engagement session really focused on whole systems mapping and understanding a little bit about who, what, where nutrition systems are working in the state of Georgia. Today, we'll be recapping that a little bit, but we'll also be really focusing more on measures and mindsets. So surfacing specific mindsets that are really important to kind of guide us through behaviors and structures of specific events that we're hoping to see in nutrition PSE change. And we're going to focus on identifying indicators that can help us measure the success and progress of these actions. And then we'll talk a little bit about opportunities for such action. Next slide. So to recap session 1 and give a very high-level overview, session 1 talked about, again, who's in the system and what are they up to. Part of what we're hoping to do with the CDC year 1 of this SPAN grant is really do a landscape analysis of what's happening in the state of Georgia. And if you'll recall, in session 1, you all participated in understanding a whole systems map. And I believe that link for the whole systems map that you contributed to should be in the chat now. That map really is to help us understand who's working, what populations are they working with, what geographic regions are they working in, what are the measures or indicators of success that are driving some of those initiatives for nutrition and health in Georgia. So looking across this map, we're kind of able to see a few different things. We're able to identify areas in which we can collaborate as a group, as a collective, and help support services rather than duplicate. And we can also kind of take a look and see what's missing, what could we add to this map to make it more holistic, more cover more bases for nutrition change that we need in Georgia. Next slide.
Christina, could I add one thing before we proceed to the part 2? Mm-hmm. As a reminder, everybody, Georgia is a state that has received 6 awards, and many of you today on this call are part of those award organizations. So if you are a Reach and Hop recipient, we'd love for you to recognize that in the chat so that others on the call today know who you are. Because as we think about collaborating across the state on the CDC work, we know CDC is looking at us as a not only a funder, but also as an entity situated here in our state that will be able to engage with us. So the other thing I would just mention is that we are trying to be incredibly transparent through this whole process. So we're letting you know who's doing what, how we're spending the dollars, what the work plans are. We put forth these work plans with input from collaborating partners, but you will help us drive work plans that are revised with your input. And that's going to happen in the meeting 3 that we will have with the collaborative action team. And Christina will talk about that later. Thank you, Christina.
Yeah, absolutely, Debbie. So we're going to kick off with measures and mindsets, and I think Jimmy has a fun exercise for us to participate in. So I will give it back to you, Jimmy.
Awesome. Thanks, Christina and Debbie. And hello, everybody. Thanks for joining us on a Friday afternoon for a couple hours of more systems engagement, and hopefully really get a chance to think and share and talk more with your peers here as we go forward. And so we frame this one as measures and mindsets. And as we work towards an evaluation plan, which Ken will be sharing a little bit about towards the end of the meeting, we don't want to just jump into a logic model and be working in that. That may work for some people on this call. A lot of us have done that kind of work before. Others, that may seem foreign, and you really want to spend more time talking about the content and how we're getting here. And so we're trying to create the space for that to happen. And so we are going to raise measures here and then start to think about the mindsets and the way we interpret them and the mindsets we're bringing into this work specifically here around nutrition systems. So that's the arc we're going for. But like Christina said, we have hopefully a relatively fun initial way to get warmed up this afternoon. And so in a little bit, Savita's going to put us just randomly into 4 breakout rooms. Each room will have a GHPC facilitator who will run the Jamboard. So no need to get the link for the Jamboard or anything. You're just watching and discussing. We're going to have 5 numbers in there and 5 measures, essentially. And your task is to match those numbers to the statistic and talk about the meaning of them. These are all nutrition-related measures. And then each group sorts them, and then we'll come back, debrief on the process, share the correct answers, encourage folks. It's the modern world. You could go Google these things pretty easily, but encourage you to just stay in the moment talking with your team about, or with your group about, well, which number is which? That doesn't make sense. That seems too low. Well, I'm not even sure what that measure means. So that's the kind of conversation we want you to have about these initial measures that come from our proposal to CDC for the SPAN award originally. So these numbers are what got us the funding to do this SPAN work, essentially. So we'll give about 5 minutes for that and then come back to the room and talk a little bit about the experience of doing that. So with that, Savita, if you can get us in our breakout rooms. All right, I'm going to room 4. All right, let's get all my boxes back in the right place here for you guys. All right, Christina, do you want to debrief folks on that one? And then here are the correct pairings.
Oh, sorry.
Group one.
Yeah.
Group one really
Did we get them all?
did some logic thinking together. Yeah. So
Hey.
thanks everyone for participating. Thanks group one for your great powers of reduction. Everybody did great. Yeah, so to give a little round out recap of our measures mix up here, 11% of Georgia's overall prevalence of food insecurity, so that's 1 in 9 adults. 54 counties in Georgia have obesity prevalence rates that exceed 40%. 13% of our children ages 2 to 4 participating in WIC are experiencing obesity, and 18% of children ages 10 to 17 are experiencing obesity. 12% of Georgia's adults are experiencing diabetes, and 37% of Georgians are experiencing hypertension.
So I know I'm going to put group 4 on the spot. We had a little bit of discussion about the complexity of some of these measures. Anybody want to share that reflection?
Well, one
So
of my thoughts
go ahead.
with the 12% for diabetes is I wonder what the numbers are for pre-diabetes, because I thought the numbers for diabetes would be higher.
Huge numbers for prediabetes.
No.
That's going to add up to like the hypertension number, right? If you think about metabolic syndrome, I think you're exactly right. The risk is very high.
Michelle?
So the complexity is that the many layers of hypertension, or excuse me, diabetes, and then the subgroup of being in WICs and that percentage, are they really, is that really representational of a larger population? Am I answering this the way you were asking for, Jim?
Yeah. We were talking about the obesity that's county subgroup and then another kind of subgroup.
So because the measures kept diluting the population, it made it a little bit more difficult to put our head around those numbers, and it caused more talking and dialogue around it.
Any other thoughts or reflections from the breakout rooms? Debbie?
Just that I think most people know this, but we have measured data on body composition through our fitnessgram. And if you include children who fall into the category of overweight and obese by BMI for age percentile, the fourth bullet becomes 33%. No other condition affects so many children as those impacted by excess weight.
Mm-hmm. All right, well, I'm going to keep us moving here. And what we're gonna, let's see, get my stuff together. 6. So we just looked at some numbers and some measures, talked about them, sorted them, tried to use logic to figure out which matched with which, but then we talked about what they mean. And what we want to do now is personally surface our mindsets. We teed up the iceberg last time, and we're going to use that tool a little bit more today. But as I was coming into this, planning these meetings, mapping them out, thinking about, well, what is the mindset? What mindset am I bringing to this? Why am I here? Why do I stay here? Why do I want to do this type of work? And that's your mindset. And I'm going to share a personal story, personal narrative from my life of how I got to these 4 mindsets that I'm bringing into this SPAN work broadly, given that I'm not in the nutrition group, but I'm broadly within SPAN. And I have a trust in systems thinking. That's one of the things I'm bringing here as a mindset. I believe in scientific evidence. I also value equitable solutions. And I know we can do this together. Collaboration is key. This is the time we're able to do this. And so we throw that language around a lot of surfacing mindsets. Mindsets are, the highest leverage part of the iceberg. If you can shift mindsets, towards the things that really support the system's change towards the direction you want to see, you want to get to that. But they're the most resistant to change because your mindset and your mental model about these systems, those are deeply seated in your personal experience and your life. And so that's what I'm going to share here now for a few minutes, is a story about an actual iceberg that I got to see in New Zealand several years ago. And so I'm going to walk through how I got to each of those mindsets. So trusting in systems thinking. I've been doing this stuff for a long time and I see icebergs everywhere. So when I got to go and actually see a real iceberg in the real world, I couldn't help but think about systems. And then as we do this work, that comes back to me. And to frame it in the terms of those measures in my life, I'm from one of those 54 counties that has the high obesity rates. I'm from Clayton County. My mom's family is from there. We have deep roots in Georgia, in Clayton County, in one of these areas that's really struggling across a lot of health metrics broadly. And my mom and I have a very special relationship because within my first year of life, we lost my father to gun violence. And so that really was an event that set the trajectory of both of our lives in a totally different course than it would have otherwise. And one of the things my mother chose to do with the Social Security benefits and the somewhat of a windfall from that tragedy was to invest in my education, and that precipitated for me a love of learning. I was able to go to some fairly prestigious schools locally through private school and high school, up to a couple of stints at Emory University and other universities. And I was the first in my extended family to go to a four-year college, and it was because of this tragedy in a big sense that sort of got me there and built my initial understanding and want to learn and go through school, did science through school. So I that's how I got into this evidence space. And I see that academic journey almost culminating in one of my first professional roles was as a research fellow at CDC in the Division of Nutrition, Physical Activity, and Obesity, where I was doing various things. But that brings me to the next mindset, is my belief in scientific evidence. That's where that comes from. There's a lot of investment in my life in education, in science, in research, in evidence. When I got to CDC, had the privilege to be exposed early in my career to some of the top minds in this field from a research standpoint, and really started to recognize that I don't think I'm that strong of a researcher. I'm not a PhD level methodologist, but I can understand this stuff. And I think the role for me is to translate these things, to use this evidence. And that's where I trust the folks at CDC who have done the lit reviews, the systematic reviews, to get us to the strategies we're doing in SPAN. Those are evidence-based strategies. Those are the things that are going to actually move the needle on the outcomes we're seeing. That's where the evidence is pointing us. So that's trusting them with that evidence. But then as I got further in my career, worked at the local health department, came here to Georgia Health Policy Center for the last decade plus, worked all across the country, really working with evidence, working with systems and equity across sectors, across populations, really doing a lot of different applications of scientific evidence. And it's really only been in the last 5-6 years, and some of the work I've ended up doing through kind of that systems frame has gotten me into this maternal and child health world, and specifically this maternal health work that we do that is very centered on equity and trying to untackle the systemic structures that are producing such disturbing disparities and inequities in maternal health, and particularly maternal mortality outcomes. And it's really clicked for me recently how to personalize that in a way that in Georgia, Black women are three to four times more likely to die in the first year after childbirth than their white counterparts. Hispanic women actually perform a little bit better, but we're fortunate enough to have enough data in Georgia to be able to look at that typically rare event as a sentinel public health event, that there is something wrong in our system when you strip out all the other controlling factors, and based on color of skin alone or the experience of racism, you see those discrepancies, disparities in maternal health outcomes. And that terrifies me, because had our skin been a different color in the same context we were in, I would have been 3 to 4 times more likely to lose both of my parents in that first year of life. And that frightened me to think about what that would have meant for my life, but even more so to know that's happening now. That's not an unusual event in these communities that we're looking to serve. Things are happening out there. And that's why we need to think about these deeper structures and think about how can we bring equity perspectives into these conversations in an actionable way. And that gets me to my next mindset of valuing equitable solutions. So it's a belief in scientific evidence, but a value of equitable solutions that bring in other perspectives. not all the perspectives we need to hear around these issues are reflected in the traditional scientific medical kind of evidence. We need to expand our view and honor and value processes and solutions that bring in as many perspectives as we can to solve these very complex and intransigent issues here in Georgia and nationally. So that's what's happening in Georgia right now. And then that kind of brings me back to my mom and this trip we got to go on several years ago. We're very fortunate. I won't go into the detail of how we got there, but we got to go on this package tour to Australia and New Zealand. It was just a lifetime event. It was just this amazing thing. And so one of the day excursions we got to do of this trip was in Aoraki National Park in New Zealand. And it was ride a bus out to a parking lot at the base of this trail to get to this Tasman Glacier, this glacial lake at the bottom of one of their tallest mountains in New Zealand. And was so excited to go to that. My mom was struggling. She has all these chronic diseases. She's reflected in these stats the same way I would be however many years ago when I still lived in the county. So working with her, pushing her within reason to give it the effort to get here. Once we got off the bus, there was a miscommunication that it was about a mile plus walk in. We thought it was maybe a quarter of a mile. We were wrong. So she was really struggling to walk on, a gravel road up and over some hills to get to this lake so we could get into the boat to actually go on this tour to see all these glaciers and icebergs and all this great stuff. And so it was just initially really proud of her that she got there, that we got there at all together. And so this is building to my value of we got here together. And it takes collaboration. It takes multiple people to do this type of work or even live. But in this story, we got here together, and then we were really rewarded with a great opportunity to see something that's really rare. When we got onto the boat, we sort of went out, and they're supposed to go in different parts of this lake and see, multiple tour groups. You don't want them all in the same place at the same time. But all of a sudden, they came on the tour guides' radios. Hey, go to Sector 5 as quick as you can. Something's going on. Oh, okay. So we zip over there, and one of these icebergs had just melted to a point that it flipped over. And apparently that's a really rare event to get to see the underside of one of these icebergs. That's what this rich blue color is. This is what it usually looks like under the water. And apparently it's a matter of minutes before it turns into the regular white ice that you would normally see. So that's why the tour guides were like, get over there so everybody can see it and touch it. And it was just this beautiful, amazing thing. And it's this opportunity that was created by mine and my mother's life together, working together, getting there together. And I see a lot of parallels here of this federal funding we have, not just with SPAN, but with HOP and REACH across the state. These investments are creating an opportunity for us to flip the iceberg over, look under the surface, talk about these structures. And to me, that's why it's really critical for us to spend this time talking about our mindsets and using these system frameworks to dissect the problem. We all have pieces of, in this case, nutrition that we know how to change. We know what's going to work, and we come in with that. But I think it's really critical for us to zoom out a little bit and collectively think about what we're all bringing to this system, because we can do this together. Now's the time that we're able to do this together. And so just to sort of circle back, that's how my trust in systems thinking got me here today. A belief in scientific evidence got me into my career. Through that career, I've developed a stronger value for equitable solutions. And my mindset coming into this work today is I know we can do this together. Now's the time. We have this opportunity. The iceberg flipped over here for a window of opportunity that we can really look at and do this work together. And so hopefully that tickled some emotions or some thoughts for you. And now what we want you to do for the next few minutes is have a personal reflection of that. We'll play some music. You can go off screen. If you're driving, just listen to the music. Don't close your eyes. But if you can, try to just reflect. And we know people don't get the opportunity in a meeting to even just take a couple minutes and just reflect to yourself about what mindsets are you bringing to this work? Why are you here in the first place? Why do you stay here? Why are you passionate about nutrition issues that are important to you? But before we jump into that, I do want to give Christina, Debbie, and Wendy, if you want to share just some other examples of mindsets that you all, personal positive mindsets you're bringing to this work, just for the group to hear a couple other mindsets before we go into reflection time.
Thanks, Jimmy. I can kick us off. A mindset that I've been thinking about a lot with the SPAN opportunity and as I've been privileged to have kind of one-on-one conversations with many of you, is thinking about collaboration and what we can do, kind of, I guess, echoing a little bit of one of your mindsets, Jimmy, what we can do together, and knowing that we are better and stronger together. So that's something that I've been reflecting on in terms of kind of looking up that iceberg, how that mindset can impact the structures, behaviors, and events we're hoping to achieve together. Debbie, Wendy, I know you had a difficult time getting on, but Wendy Palmer is our co-lead for nutrition with Children's Healthcare of Atlanta and Strong for Life. So she'll be helping guide some of this work as well. And not to put you on the spot, Wendy, but if you have any mindsets you want to share, you're welcome to.
Thanks, Christina. I definitely wasn't prepared for that one. But I think I might echo a little bit of what Christina said. Like I've been doing work in this space for a really long time, and have been here in Georgia for a really long time too. And I think one of the mindsets that I hope I can bring to this discussion and to this table is that the opportunity for collective impact. I think we all individually are doing tremendous work in our current roles, in the communities we serve and communities we work in. And I think there's so much power to be harnessed by collaboration through the work that SPAN can hopefully lead us in that direction. And I'll be really transparent. Sometimes it feels like duplication of effort. Sometimes it feels like territorialness. I think coming to this table and really thinking about it from that perspective of collaboration and collective impact is what I've been thinking about.
Great.
Thanks,
Debbie,
Wendy. Yeah, I just want to say mine is personal. I think many of you know me. I see so many friends on when I'm looking at the participant list today. I grew up in a town of 600 people. I'm the youngest of 6 kids, Dave, Donna, Dan, Darla, Doug, Debbie. And my mother was a gardener. And so we spent a lot of time pulling weeds and growing food. And so when I think about my mindset around food and food access, I am passionate about ensuring that all Georgians, including and most importantly, those in the rural areas where our food is grown, get access to that food. And that mindset of being passionate about rural health shapes everything that I do for SPAN and all of my other projects. So I hope you really guys, I know many of you, you're very passionate about this topic. So I hope you take these few minutes and reflect on your mindset and why you're here, because most of you share our passion for this topic.
Yeah. So we're going to go into that. It'll be just under 2 minutes. The length of the song, go off camera, go on mute, look at the pretty icebergs, listen to the soothing, hopefully, music. We'll see how the music goes over. And maybe jot down what you arrive at as your mindset, because this will come into play a little bit later in the exercise. We're not going to ask everybody to report out on their mindsets here. If you want to pop some in the chat, you're welcome to, but there's no expectation of you sharing here. This really is your time to think about yourself, your mindset of why you're here and what keeps you here. So take a couple of minutes and go. Too much music. All right. Well, hopefully that was reflective music and didn't put folks to sleep. But thank you for taking the time, and hopefully got in touch a little bit with a slightly deeper layer of why you're here today, not just because you're doing this work, but you're doing this work for a reason, and hopefully that helped you think about it a little bit. So we're going to move into a little bit more of the didactic part of this, focusing on this systems iceberg as a tool. It's a way to think about complexity and complex systems and identifying the opportunity for change within those systems. And I'll walk through a sequence of this where events are the things we see. That's the headline measures. But under the surface, you get into behaviors. What is the system doing to create those outcomes? What are people doing to create those outcomes? What's happening? Then the structures, those are the policies, plans, the environments, the things that set the context for those behaviors. And then under that are the mindsets. And the mindsets we bring influence the structures we're able to propose. There are also mindsets that push against us, and those might need to change. I'll get into that in a minute. So I'm going to walk through an example, kind of more from my life, but hopefully is a tangible example for everybody. And then we're going to come into a nutrition specific one based on some of those statistics or the measures you worked with earlier. And we'll have a full group kind of discussion about this example one. And then we'll go into breakout rooms. You'll get to select which subsystem you want to go and work on an iceberg with a facilitator for about 20 minutes or so. So that's where we're going. But to talk first about the event layer. So it's the visible part. What's happening right now? Often these are talked about as the headlines, or these are the metrics. That's that 54 counties have obesity rates over 40%. I forget the numbers off the top of my head. The other numbers, 18% with hypertension, whatever it was. Those are those kind of headline measures that are the events that we reacted to by proposing and getting these funds to react to this by going deeper in our system. Because if we're only reacting to diabetes or heart attacks or something like we're only reacting, you've got to react. But if you're only reacting, you're only treating the symptom of a deeper problem. And I think that's why a lot of us are here. We know that there's these deeper structural reasons why WIC enrollment might not be as high as we would originally like it to be. There are things we can change in the system to get more low-income families access to healthier food so that they have less diabetes, less heart disease going forward. And thinking about the events in the context of outcomes. So here the example, something especially the folks in the Atlanta area, but I think probably everywhere can identify with: traffic congestion. You get on the road and there's a traffic jam. That's an event. It happens almost every day. That's important in the context of these outcomes of economic productivity, quality of life, morbidity, mortality. We know a lot of negative health effects come along with this event that happens every day, traffic congestion. But if we're just reacting to that by changing our route one day, or we hear or we don't hear on the radio anymore, we look on our phone and see that we're getting rerouted around the traffic. That's reacting to the traffic. That still gets you where you're going. That solves the problem in that instance, but it doesn't solve what caused the problem. So doing the systems thing and getting under the surface to these behaviors, structures, and mindsets is how you prevent the problem from happening, get at the causes of the causes. So once you go under the surface layer, then you're starting to think about, well, what's been happening over time? What are people doing? What is the system doing? It's kind of thinking about the verbs, using things, eating healthy, going to places. These are the types of actions that happen within the system at the behavioral layer. And you can start to think about the patterns of these. And that can be trends over time, as well as disparities across geography. How are these events happening differently in different communities across our state? And when you're thinking of this layer, you can hypothesize what might happen in the future. So this is where you're starting to think about, well, why do we see that traffic congestion every day? Well, in the most basic sense, it's because people are driving to work at rush hour. That's why the traffic jams. Then people drive. That's a personal behavior that's happening in this system, transportation system, that leads to congestion. On the other side there is constructing highways. That's a system behavior. We continue to construct highways. That leads to more traffic congestion over the long term, because you add those couple of lanes, that's great for a month or two, maybe even a year. But eventually those lanes also fill up with cars because people are driving to work. And so the system is creating that construction behavior that's contributing to that event. But then why is the system doing that? Why are people driving to work or not? Why are they making that choice? You go deeper into the iceberg, deeper under the surface, and you get to this structural layer. And that's where we're working in the SPAN space when we're talking about making policy change, changing the shifting the design of programs, you're designing at the structural level so that, be it the end consumer, be it physicians, be it policymakers, behave in a different way. They do different things because of the structures, these physical environments, policies, other rules of the system. We talked last time about the whole system map and all of us being elements in the system. And that's what the whole system map helped us look at, is each of us as an organization, what are we doing and where are we doing it? Those are the elements in the system. The structure is about how those are connected to each other under the surface of the events that we're seeing, and thinking about those relationships. So here, why are people driving to work? There's remote work policies. Maybe everybody had to drive to work. We saw a big change of that in COVID. All of a sudden, you couldn't go to work. Turns out you can work from home. So a workplace policy is something that influences the personal behavior of driving to work or not. On the system side, an environmental structure that leads to us constructing more highways is our existing road networks. Our road networks are designed in a way that preferences moving automobiles quickly from point A to point B on a highway system. So that already exists. So it's relatively easier to add to that system, continue expanding that existing type of environment, because that's what we know, that's what the system knows how to do best. So we sort of default to that. So that's how that existing environment leads to that system behavior that contributes to the events that we're seeing. And so down at that mindset level, that's where we start to get at the assumptions, beliefs, values. Earlier, I was trying to very intentionally use those words of I know, I trust, I value, I believe. And as you find yourselves doing this exercise, if you find yourself using those words, you're probably talking about something at the mindset layer. Often people kind of put that in behavior. People think this, that's a behavior. It is a behavior. But in this context, it might be a mindset that may need to shift in a direction to get to where we want to go. And so these beliefs that keep the system in place or change the system, those inform our mental models, and they can be conscious or subconscious. So this is how we think about this work. That's why we wanted to start with that piece. So in this example, remote work policies, a mindset around that is remote work's less productive. If I have that mindset, I'm not going to let my company have a liberal work from home policy. I think mindsets have shifted around that to see that, a lot more people than we thought can work productively from home. So we need to re-examine that. And that change in mindset is creating a space where now our own organization is going through changes to our policy about teleworking and remote working and how does that look? Because we have more knowledge and we have a different belief about the productivity of that type of work. On the other side, the simple one, why do we have so many roads? It's because the decision makers, the system reinforces its belief that everybody drives. That's the preferred mode. We all just want to drive ourselves. True or not, if you're thinking that everyone can and wants to drive, the solutions, the structures that are going to be apparent to you are road structures. You're going to create structures for people to drive in. That's going to lead to more cars, more driving, more congestion, more traffic congestion day to day as an event. And so I know that was a whole lot to throw at you, but really want to tell, when we talk about telling these system stories, that's what we're talking about. This mindset about remote work led to remote work policies as a structure, led to people's choices to drive to work or not as a behavior, led to this traffic congestion event that we're concerned about. And that traffic congestion event is important because it affects morbidity, mortality. It affects these things that are important. And on the left, I think this is what we shared last time as a teaser for this, is sort of showing how the leverage gets higher as you go down, because you're reacting to events, you're anticipating behaviors. But here in the work we have now, as we flip this iceberg over and we're able to touch it and work with it, we're designing the structures and we're interrogating and hoping to, over time, transform the mindsets that bring us into this work. So that's the detailed version of the iceberg. And now I'm going to switch over to the Jamboard and let Christina and Wendy and Debbie talk a little bit about an actual example from the nutrition world based on some of the metrics you guys saw earlier and that were in our application. And I'll stop talking and let you guys guide me on how you want to talk about this.
Thanks, Jimmy. I can kick us off to start this nutrition example. So we give this example, we'll talk a little bit more in breakout groups, but to kind of go through the example here, we're looking at some of those measures that we looked at for the exercise at the beginning of this session. So at the beginning, at the top left of the example on the screen, sorry, I'm watching you, Jimmy. Can't do two things at once. We see the statistic Georgia's overall prevalence of food insecurity is 11%, 1 in 9 adults and 1 in 8 children. We also have this statistic, 54 counties have obesity prevalence rates greater than 40%. And many of Georgia's youth and children are experiencing obesity in Georgia, overcaloried and undernourished at the same time. So those are some of the events that we would think about for nutrition examples. Going down one layer, what are the organizations, people, or systems doing to cause this event? So what are those behaviors? Examples of that would be a lack of access to affordable and healthy food. Really impacts many Georgians and across zip code, geography, and income levels. Additionally, access to and use of programs that can provide food assistance and access to healthy food. So these are different behaviors from a personal and a systems level that impact some of those statistics we saw. Looking at the structures, what are the policy rules and environmental factors that set these contexts of behaviors to happen? What allows this behavior to happen? Partnerships and collaboration between food procurement systems and distribution systems, and settings where food's available. Sometimes those partnerships are not in place, particularly in rural areas like Debbie mentioned earlier. And sometimes they are. Maybe they need to be expanded and enhanced. Other programs such as SNAP, WIC, CACFP, becoming a provider of those programs can be challenging. It can be a barrier for people to be involved in, and it can be difficult to report and track. And so, yeah, so we talked about mindsets. And so Debbie listed mindsets of, really a passion for rural geographies. My mindset is really collaborative. What can we do to move some of these structures and behaviors and kind of get to more positive events in the nutrition space? All of those things help set the foundation for shifting those structures and moving our way up the iceberg in a positive direction. So if we look on the right side of the iceberg, Jimmy's got some more positive metrics that we would like to see happen. So how could it be? And so on this side, we have things that we might want to emulate more of. So that top headline for an event, every month we receive 9 million pounds of donated food and grocery products, with 23% of that being fresh produce. That's a direct quote from the Atlanta Community Food Bank. 23% of direct produce, I think, is a big initiative with this SPAN grant that we're hoping to increase on, have more fresh, healthy foods to be available. That's a positive event that we want to see expand. And so what are some behaviors that can help contribute to that? Increase access to healthy food for residents. We might narrow that down a little bit more in terms of, promoting and market participation in federal programs, SNAP, WIC, and CACFP, so that more people are aware of the programs and they have access to participate in it. Increasing knowledge about nutrition recommendations, that would be a priority of the food service guidelines strategy, and increasing WIC referrals. Another event that Wendy and Debbie can probably speak more on is increased WIC enrollment across the state of Georgia. That's a positive event that we would want more of. Increasing WIC referrals would certainly contribute to that positive event. So for structures, we want to probably look more at state level policies and activities that can help increase the use of those fruit and vegetable voucher programs and produce prescription programs. And we want to increase our network of partners to be able to collaborate to do that. Yeah.
So I just want to jump in because I don't think we said it in our pregame that these are our strategies. These are the SPAN strategies that are the structural changes. So state level policies, that's what we're targeting with SPAN. I just want to make sure that was clear.
Thanks. Increasing network of partners, going back again to what Jimmy said earlier in this presentation and what Wendy and I both have echoed. Collaboration among all of us together is really what's going to help drive these things forward and make the most impact that we can across the state. And so mindsets, going into that more, looking at more equitable approaches. How do we do this equitably to ensure all Georgia communities have access to healthy food? How do we improve access to nutritious food that can help reduce chronic diseases and help improve health outcomes? How can we increase physician confidence and competency in nutrition? That would be a mindset shift in the healthcare sector, for example, to help drive some of this work. So this is what we'll be talking about in small groups. I don't know, do you want me to go on, Jimmy, to prime for that discussion, or are you going to go over that?
Christina, can I just add one thing to what you've
Yeah,
said? Is that
absolutely.
okay?
Yeah, Debbie,
I just
Wendy, add anything here, and then we'll move into exercise time.
Yeah, everybody, you might be saying, how does this apply to me? You all are passionate about nutrition. You all are passionate about ensuring that we shift mindsets of Georgians, especially Georgia's leaders, around nutrition, whatever your passion area is. I see Cheryl on here. I see Megan on here from the food bank. Wendy as a clinical dietitian. You guys have worked in many of these spaces. So as you're thinking about Christina's overview here, and you're like, does this apply to me? We're about to embark on that path, but we want you to think about it in the context of both your personal passion as well as your organization's passion and understanding of the systems. You might be put into breakouts, but you're going to have passion and topics. These are dynamic documents that we'll continue to add to. So please be aware, personal and professional, organizational is what we're asking for you as we go into the breakouts.
And Wendy, anything you want to add at this point, or just get into breakout and start digging
Nope,
deep?
I'm good.
All right. Oh, and all the things keep coming back to me that I wanted to make sure to point out too, that this one, where did my mouse go? Around WIC enrollment, that's something I added kind of at game time by looking back at this whole system map. And where did it go? It was the Georgia AAP. I came right to this and pulled that language directly from this whole system map, because to me that it's stacked that way. WIC enrollment's the event. The referrals are the things that get you there. Increased knowledge is the thing that gets you more referrals in that behavior space. Having a stronger network of partners helps to increase that knowledge and referrals, and then doing things to have physicians' confidence in nutrition topics so that they're recommending these things kind of got at a mindset issue. So I just wanted to call out that connection between what we're doing here today and what you guys shared last time in the other tool that we used. I missed that part. What's the question? Personal, professional, and what else?
Organizational.
Organizational. Awesome. All right, so now I'm gonna hop back to slides for a minute just to give us directions. So we're gonna go into breakout rooms 223. And we decided to go ahead and define them by nutrition subsystems, because nutrition is such a big topic. We got multiple strategies going. So think about, you'll be able to self-select into a labeled breakout room, either the charitable food system, food in the health systems, including public health and healthcare systems, the school and early educational system, food systems, and then the community retail environment, those types of food systems. So we felt like those were four. Sorry, I forgot a parentheses in there. But each group will be working in a different frame with a different facilitator. But what we want you to do is come up with a couple of key events. They can be the same events that we've already talked about. We want you to just get a couple of key nutrition related public health events, and then start working down. Start thinking about the behaviors that lead to those, the structures that facilitate or inhibit those behaviors, and then the mindsets that underlie all of it. And we really want you to certainly share the reality of what you're doing, which may be observing a lot of lacks and a lot of deficiencies, but we also want to keep an aspirational tone around some of this. So where you can, think about what is working or what could work better and the things that are going to get you there, because we don't want to just have all the negative mindsets and all the things that are changing, but we want to be able to highlight the things that are working too in the system, because both things are happening at the same time. So we'll give you about 20 minutes to do that in a group. Be sure to identify somebody from your group to report back when we come back to the main room, and just share one system story. So kind of one connection from event, behavior, structure, mindset whichever direction you want to go, just share one example from what your group comes up with, and we'll reconvene to do that in a minute. So with that, and we'll pop the Jamboard link in here so you guys can play in these Jamboards too, even though the GHPC team will be facilitating. Feel free to move things around on your own. So we'll get that link in the chat for folks. Do we have that in there yet? I bet we're all copying and pasting at the same time. There it goes. All right. And so Margaret, you popped on and made me lose my train of thought. Savita, there you go. There you go. Okay. So if you scroll down in the breakout room window, you can pick which one you want to go to.
And how much time do we have, Jimmy?
We have 20 minutes in the breakout room. So it already started. So 19 minutes, 43 seconds in the breakout rooms.
Thank you.
Are y'all interested in joining one of the breakout rooms?
Yes, I thought it was automatic.
No, you get to pick which
Okay.
which one you'd like to join.
Oh, yeah, that's right. Okay, so how do I? Okay, I see them.
Sorry, I thought I was picking, but I couldn't see it.
Are you able to see them now?
There's a button at the bottom.
Oh,
Voice-
okay.
Yeah.
Thank you. I could see the groups, but not the.
Thank you.
No, I still don't see it.
Which group would you like to join?
Sorry. So I'm in group. I wanted to go to group 1. It said group 1, slide 6.
Okay, charitable food systems.
Yeah, and I can see the group 1, but I can't see where to get into the.
I'll put you there.
Thank you. Sorry about that. Thank you.
Hi, Jean. They are in breakout rooms right now.
Okay.
We have
Maybe I will. How long have they been in the breakouts?
about 5 minutes, and there's 15 minutes left.
Okay, and what are they talking about?
They're doing a systems mapping.
Okay,
And there's charitable food systems, health system, including public health and healthcare, school and early care education, and community and retail food system.
How about health systems?
Health systems, okay, I'll put you there.
Okay, thank you.
Hi, Erin. They're in breakout rooms right now and have about 7 minutes left. I'm not sure if you're interested in joining one of them or hanging out here until they come back.
Well, you can throw me in somewhere or catch me up to date, whatever you like.
I'll throw you in somewhere. Do you have a preference between school / early care education, community and retail food systems, health system, or charity? Early care?
Like is good.
Okay. They'll catch you up.
Thank you.
Looks like the gang's all here. So now, how was that? We had a good discussion in room 4, and as we did last time, I think always you sort of run out of time once you get going. You start realizing how much of this you could go through. So I'll put it out to the room. Which group would like to share their system story first? And then I'll just navigate to the appropriate page.
Group 4.
All right, that is the best group. And I'm not
Okay.
biased at all.
Not biased at all.
My mindset is that group 4 was the best, but I'm welcome to have that challenged.
All right, so group 4, community and retail food systems. So how it is, what's happening that concerns you, measures. So what concerns us is low food security and access for students and student staff and faculty with children. So how it could be what's happening that you like, could be an increase in knowledge about availability of services. What are people, organizations, or the system doing to cause this event? It could be the increasing knowledge of non-nutrition faculty that are not aware of resources. It could be the faculty with expertise on nutrition and just the knowledge can raise awareness, and also normalizing access to resources for all. What could people, organizations, or the system do more of to cause this event? To connect local institutions with local vendors. So like a farm to table type of program. What are the policy rules and environmental factors that set context for these behaviors to happen? So would be campus food banks that's available to faculty, staff, and students. And it could be like a clearinghouse for online resources that's accessible to all, about resources that are allocated, what resources are available, how to sign up. Because one of the things that we said is that there is sometimes what's this third level behind
Structures. All right.
Yeah, so that I guess this doesn't quite fit in structures, but I do think it's part of the structure idea of you taking that in order to receive benefits, at least for people who are lower income, in order to receive benefits you're taking from something else. I think that's part of frankly, I think that's purposeful, but that's another conversation. How it could be campus food banks for faculty, staff, students, for everyone, and then programs for accessing local food and vegetables, and hopefully lower priced and local fruits and vegetables, and addressing, or frankly even uncovering, transportation challenges that contribute to nutrition and food security. And what beliefs and attitudes allow these structures to exist. But one thing that we came up with is it's a mindset shift of, I don't want to take from someone else in order to receive these benefits, when in fact there's an abundance, and a lot of things go to waste, or this idea of I am not that needy. So almost a change in an acceptance of assistance, and knowing that if you don't take advantage of it, it will be wasted, so knowing that it is not at a cost to anyone by you participating. And how it could be, what beliefs and attitudes allow the structure to exist is the resource abundance mindset, and I think the knowledge of what is in fact wasted at a system level, what goes to waste, what is available for you that could offer a cushion and that could help you and to make an impact for food access.
Yeah, thank you, Kelly. Yeah, so that's all right. I was excited in our discussion, and we got to that mindset, and there's a very clear shift of the people in this context, university sort of system, but that could expand out, is, well, I don't want to use these services because they're not really for me. I'm not that needy, but some of it's going to waste. So if you shift that mindset to a little more of a resource abundance, that there is enough, we can support more people, we need to do that, then you're going to start to see more people create these online resources that are accessible for everybody, marketing in a way that lets people know that these these options are available for everybody to use. Like, so I was excited that we got down to that mindset discussion. So thank you to group 4 for that. Which group's next?
Should we just count down, Jimmy, and just go to 3?
Sure.
See, Michelle, I'm sorry to interrupt you, but our reporter needs to leave in 5 minutes. Is it okay if group 1 goes, or do you have to leave?
Oh,
as well,
sure.
Michelle?
That's fine.
Joy and then potentially Ruby.
You guys got a lot, so try to focus on 1 or 2 of these stories. You can.
Okay, I can talk about the Farm Bill funding. Okay, I will start with the Farm Bill funding, which is, as you know, up for renewal. That is the food bank's most reliable source, because we do rely on donations a lot, but this is our most reliable source of healthy foods that we get. And so behaviors that kind of lead into that are just infighting, political infighting, lack of understanding about the people who are being impacted by these decisions, and maybe also the lack of urgency because they're not directly being impacted by the potential of TFAP funding not being there when it's needed. And then structures, like those, I don't think we had a structure that was specific to that one. We talked about a lot of different things. But I think the mindsets are definitely related, because there is a lot of shame, stigma around people who do access food through the charitable food system. And the stigma kind of goes both ways: stigma from the people who are receiving the food, and also stigma around people who aren't receiving the food, or who are like making the decisions that affect those food sources, about it being kind of not something that they would ever have to deal with in some way. On a more positive note, I can talk about the one that I said, which is the food banks transforming access together initiative, where we are starting to think more about our neighbors' experience accessing food through the network, and how can we make that more equitable, frequent, convenient, and consistent, to really make a dent in somebody's food security. And that was born out of our DEI journey that we've been on over the last couple of years. And that was partially in response to the pandemic. Megan, feel free to jump in here if there's anything you want to add to that. But the pandemic and a lot of the protesting that was happening in Atlanta definitely was part of the story with that. And structures. Yeah, and I think that being on an equity journey over the last couple of years has made a real difference. And the mindset of the people who work at the food bank, people who lead the food bank, and also a lot of our partners as well, as we have a lot of these conversations. So I'm seeing a real cultural shift happening as a result of that, which is very exciting.
Thank you,
Thanks, Joy.
Which group wants to go next? Do we go back to 3?
That works for us.
Okay. Group 3. School and
Um,
EC system.
Okay, if you can expand it a little bit bigger, I need new glasses. I volunteered to report. Okay. Prevalence of malnutrition, obesity amongst school-aged children. So, of course, the positive, what we want to do is we want to reduce the malnutrition. Can you move it to the side so I can read the center? So the event is, thank you. Event is the malnutrition. We want to reduce that. Behaviors. behaviors that help reduce that is taste testing and interactive discussions with students, and I'll try to describe this as briefly as possible. So, hey, oh, you chose celery. Did you know celery is a negative food because it takes so much of your metabolism to eat that? Or, wow, that's such a healthy choice with that apple. Can you take a bite of that? Because it breaks up yuck mouth and all that fiber is really good. Or, oh, a cucumber like that. Have you ever seen somebody that's got electrolytes? That's like nature's electrolytes. Have you ever seen somebody light up a pickle or have the nutrition department or staff talk about the benefits of the body and then make it available to them in taste testing where you don't yuck your yum? Everybody close their eyes and taste it to themselves and such. Structurally, some changes. I feel like we talked about a lot of different things. I feel like I may have gone down a wormhole a little bit more. But the programs to teach students about fresh food and what it comes from and the benefits. Um, I'd love to hear from a couple other people in the group if they could give some examples, like they took away prepackaged foods and had scrap cooking, and changed the structure of the kitchen and how that was set up, and the resources available to make the food preparation and fresh food. But that has to be hand in hand with the how do you eat this food that you have um, no experience with, and prepare it. And then mindset change, source of healthy foods in the school system, investing in children. So we talked about that mindset change, like in schools, academics and performance of the schools is how the educators are rewarded or punished. So how do students perform better? Well, if they eat better and they're not crashing because of too much sugar, or they're not dehydrated, or they can focus better because they have a more solid fiber rich food, or they have more vitamin K, or they're healthier, so they have better gut health and digestion, they can make it to school, and just all of those performance measures come from that healthier food. I hope I did some justice, Margaret.
Awesome. Thank you, Michelle. And group number 3, that's a great way to reduce malnutrition and obesity in and among school-age children. All these great things can happen, and these structures can exist to facilitate these behaviors. You have a policy for taste tests, then you can conduct taste tests. You get kids eating the food. Hopefully, over time, that reduces the malnutrition issue. Last but not least, group 2 in health systems. Clayton's hungry. WIC numbers are increasing. Tell me about that, somebody.
Hey, so this is Christina, group 2. Yeah, so the event that we focused on the left side of the screen was that Clayton is the hungriest county in the metro Atlanta area. And a lot of behaviors go into this, part of it being lack of nutrition education and intervention in the area, lack of access to nutritious foods, and to those programs that would help residents of that area be connected with those resources. For structures, we talked a lot about the impacts of other geographies on Clayton. So housing displacement in other locations has had a major impact of the Clayton County. Lack of walkability and bus systems and transportation in general in Clayton has added to this. Displacement of communities that have been impacted by gentrification, impacted by economic instability because of this, and then rural communities. So those communities having difficulty accessing most of the resources that are located in the metro area. Additionally, we have more convenience and fast foods available than healthy retail outlets in those locations. And then kind of thinking about mindsets from a health systems perspective, the healthcare system is unfortunately more reactive in solution making than proactive. They are more driven by dollars and cents sometimes than they are driven by the outcomes that we would like to see prioritized first. Lack of an incentive to kind of think about those those long-term solutions that will have long-term benefits as opposed to a short-term return. Those are all mindsets that contribute to this event of Clayton being the hungriest county. We used a different example for how it could be. We used the increasing WIC numbers happening across the state as something that's positive that we would want to see continue and expand across Georgia. So an example of behaviors that can contribute to increasing numbers, having WIC information available via an app. I think one of our group members said that's coming soon, if it hasn't already. And then having WIC notifications, applications, information in general available in all languages. That can be a major barrier for recipients that are primarily speaking another language other than English, especially when accessing and utilizing those services in a store. From a structural standpoint, expanding our programs and our policies surrounding double bucks through Wholesome Wave Georgia is something that could contribute to those increasing WIC numbers, as well as other food as medicine programs. And we didn't quite make it to the mindset, but I would kind of maybe argue food as medicine as a mindset shift as well would be helpful. So kind of reducing that stigma that others have talked about, and yeah, sorry, I can't think and watch the screen at the same time apparently, but I'll leave it at there. Anybody else from group 2 want to add to that? Anything that I've missed?
All right, thank you, Christina. And group 2, and just because it's my home spot, I'm curious, are you guys saying that Clayton County is a rural community?
This is Shauna. That was a point that I'd mentioned, that while Clayton is in Metro Atlanta, because it's so spread out, some of the areas could be considered rural, like once you move beyond like Tar Boulevard, Morrow, etc. The density of the population density is a bit more spread out, and so access to grocery stores is limited.
Yeah. Okay. Yeah, I don't want to go down that tangent. I think I would call it more of suburban. Yes, it is lower density, but Henry County next door, Fayette County next door, those are still suburban communities. I think when we're talking about ruralness in this space, there are specific definitions. So I just wanted to call that out and just gut check that
I agree. Those were the points I noted in our discussion. I agree.
Oh, that's great. Thank you. All right. I'm going to stop sharing and hand it over to Ken Goodman to talk a little bit about how do we codify this. So we've just done a lot of thinking and brainstorming and thinking about different parts of the system. But now as we move a little bit more towards what are we actually going to do with these SPAN awards? What are the actions we're going to take? We're still figuring that out, but we need to come up with an evaluation plan. And what are we going to measure? How are we going to look at this? So what Ken's going to share is some of the logic model evaluation stuff. And I want you to think about that really is like turning these icebergs on their side to the right. So the events are these long-term outcomes, and the way we measure and think through these logic models, I hope you can see, is pretty analogous to the way we're just thinking using the iceberg, but it gets a little more focused. So Ken, tell us about evaluation, please.
Sure. Is everybody seeing my screen?
Yes.
Awesome. Okay, so just to start, I wanted to show you, this is the overall logic model for the whole program. And you can see that there's a couple of rows that are related to nutrition. And one of the things, and it all leads to the same sort of health and behavior outcome, long-term outcomes, and reduction in disparities outcomes. And so it's all supposed to sort of work together to lead to those outcomes. And one of the things that we'll be doing in the near future is really breaking out each of these rows. So the whole row about food service and nutrition guidelines, and another one about, fruit and vegetable voucher and prescription programs, will each have more detailed logic models where we can add more of the individual activities that will happen, what outcomes will come out of those, how we'll measure those things, and even more short-term outcomes. This is the very simplified version from CDC of the major logic model. And the next process will be to really collaborate on detailing that more. So I just wanted to show you, we're submitting the draft evaluation plan to CDC at the end of this month. And it will mostly contain the performance measures that we're going to look at, primarily the things that are required by CDC, but we're also, pulling some of the measures of success that people put in the first session, the first systems mapping, when people were putting in what they do and how they would want to measure success. We want to make sure that we incorporate the kinds of measures that all of our partners are interested in, as long as they sort of focus on policy systems, environmental change. But so that this project is helpful to you all as well. And we're not just working to please CDC, we're really working to please our partners, in order to achieve the things that we want to achieve in Georgia. So I wanted to just quickly show you, for each of these parts of the nutrition foci, I guess I would call them, of SPAN, there are milestones that we have to measure as we go. Part of it, and these are more like things that we're supposed to do over time: review the food service landscape, develop food service guideline plan from that, and then add or enhance food service nutrition guidelines, either at the state level or, we may do it smaller scale to build up to the state level. And those are things we have to track for CDC. They have, for food service guidelines, required performance measures. And they're pretty basic, there's settings and reach. So the number of new or enhanced food service guideline policies adopted or implemented, the number of sites that are impacted by these new policies, and then the population reach, the number of people that are impacted by those sites that are implementing the new or enhanced food service guidelines. These are things that we are required to measure over the 5-year period of the project, but we'll try to add performance measures that are maybe more specific to exactly the sorts of things that we'll implement over time. So this is really sort of the basics of what's required. And then when it comes to the fruit and vegetable programs, the milestones are the landscape analysis, again, to develop or to help the development of voucher incentive and prescription programs, and develop or enhance an existing plan to address fruit and vegetable vouchers, et cetera. So these are the things that we're going to be doing, and then we basically report on to CDC that we're doing these things. And then for fruit and vegetable programs, the required performance measures, once again, setting and reach, the number of places that are newly issuing vouchers or places with enhanced processes for providing vouchers for fruit and vegetable incentive programs, and the same thing for the produce prescription. And then when it comes to population reach, the number of new enrollees in these voucher incentive programs, or the number of new enrollees in produce prescription programs. These are, again, the required performance measurements, and there may be commonalities with some of the other awardees, like the HOP and REACH awardees in the state, that maybe we can collaborate on some of these. But again, each of the partner organizations have, measures of success that they want to include. And I think, what we'll try to do is be very responsive to make sure that we're responsive to our partners. And
And
then
can I ask a question quick?
Sure.
Unless you have a couple more slides, I don't want to take you off your game.
No, go ahead.
So I'm not sure if I'm speaking for more than just me, but I always try to be as vulnerable and transparent as possible. There's a lot of acronyms that are used. I'm relatively new to this group. I think I know a couple of you, but I then, because I don't know what the acronym stands for, I get a little bit lost, and then my focus turns to more of an insecurity of, do I belong? Am I worthy? And that's my own baggage, but is there an opportunity for some basic kind of glossary, or what do these acronyms stand for? and maybe a directory of who's in this and are they of the same organization? Because I want to give you my all, but then my psyche gets in the way when all this stuff is going on around me that I don't have the connection to understand what you're saying.
Sure, yeah. And a lot of this stuff is maybe new because folks are implementing programs that are maybe aimed more at behavior change, trying to get people to behave in a certain way to, like we were talking about in the schools, trying to get the kids to actually eat the healthy foods that you provide to them. And this program is really focused on that sort of higher, or you could say lower, it depends on the iceberg direction, structural policy level, changing policies in schools so that they will serve healthier foods, or changing the environment to make it easier for people to walk and bike, those sorts of things. So yeah, there's a lot of new stuff, new acronyms, new terminology that I think a glossary is a really great idea.
And I'm happy if I ever introduce something, which I wish I'd keep my mouth shut more, but if I ever introduce something, I'm always happy to serve on that. I'm not one of those people that says, you should do this and then not be a part of the solution. So if there
And anytime in any of these things, if somebody's throwing around acronyms, put it in the chat or jump right in and say, okay, what are you even talking about? Because in public health, in these sorts of fields, there are thousands of acronyms. Nobody knows them all. Maybe somebody does. So anytime you have a question, feel free to jump right in.
Michelle, we're still working on we have a sort of slide deck that's a SPAN overview. We have a 1-pager. And so your suggestion to add acronyms to that will be very helpful. So thank you for saying that.
Yeah. And not even just the acronyms, but just terminology. A lot of it's new. And just to wrap up, the overarching evaluation questions, this is from CDC as well. How have state level policies and activities affected local implementation to improve healthy eating, physical activity, breastfeeding, early childhood education outcomes? And then how have health equity approaches been prioritized at the state and local level? Again, these are the two required evaluation questions, but one of the things that we'll continue to do as we move forward is get everybody's input on what are the questions that you think we should be asking or answering over the course of this project in terms of evaluation. So I'm just showing the basics, but we'll want people's input. And then a step after that will be to go even deeper into the community level of people that we'll be serving and trying to get their input on what do they think should be measured and what questions should be asked there. So over the course of the next year or so, we'll be getting more and more delving deeper into what is it that we want to measure, not just what CDC requires, but what's going to be helpful for all of us.
Ken, as a reminder to everybody, you guys, we are obligated in the state award, nutrition, physical activity, breastfeeding, obesity prevention, farm to early care. The High Obesity Program, or HOP awardee at UGA, is working in specific strategies. The nutrition and physical activity ones overlap. The REACH awardees are working in specific priority areas. The nutrition and physical activity overlap. So that mapping event in April, and we know we can't bring everyone there. A, we can't afford it. B, the room won't accommodate it. But what we're trying to get to, Michelle and others who are asking about sort of the collective vision, is literally a visual of where everyone's working in the system, where we're doing the things we need to be doing at the structural level, where we're doing other activities that shore up or cement this work, and where we're missing, right? Where there are points of leverage and where we're missing points. So the measures that Ken is putting forth, we're all obligated to do as awardees, but many of you are actually working in different spaces that we want to embrace and capture. We want you to take our collective impact for your work and then also embrace what we're trying to measure as awardees in the state so we can really shine as a state.
Yep.
Awesome. Thank you, Ken. And Christina, I was just chatting with you about it to move us towards wrap up, but I forgot we do have a slide of some initial kind of indicators and things we might want to glance at, and then let you move into the wrapping the meeting up. So I'll share the screen again and hand it to you to talk.
Thanks, Jimmy. So these are directly from our GSPAN proposal of some strategies and then some measures that we had offered as addition to indicators to track in addition to what the CDC is requiring. So if you look on the right-hand side, some of those might be for improving operating structure, technology, family engagement. Some measures might be dollars matched annually, number of family engagement activities offered. Some of those locations that are accepting SNAP and WIC, EBT. These are just, I won't read the whole slide to you, but there's a variety of additional measures that we thought about. And we can post this back and include this. This is included in the slides when we'll send out that to the group here. But if you'll take a look at this and think about what measures here that are listed make sense? Are there any that you would propose that are different that would be helpful for your organization and still kind of fall under this PS policy systems environmental change that SPAN is asking us to really prioritize? That way we can make this as cohesive as possible and as beneficial as possible to everybody here. Something that I'm pondering as we're talking, especially about shared language and acronyms and guidelines, is to think about one thing that I'm going to think about for this work is to maybe put together a nutrition specific packet that has some of this SPAN language in it, kind of broken down in plain English, as well as some of those acronyms that we have talked about today that would be helpful to have that glossary. I appreciate you saying that, Michelle, and I think that's really important. And so that's certainly something that we can include just to make it a little bit easier for everybody to be on the same page. So I think that'll wrap up this piece, but yes, please let us know if you have additional measures or indicators that you would like to see.
And to tie it again back to the whole system mapping from last time, this is one of the reasons we asked you, how do you measure success? So we've got a little bit of that from you guys. And as we continue to move forward with this, we'll be turning that into some of these specific measures and indicators that may or may not go into our evaluation plans. All right, Christina, what's coming next for folks with the nutrition action team?
Yeah, so two additional meetings that I want to draw your attention to. We'll be kicking off our first quote unquote regular CAT meeting on April 8th, 2024 from 10 to 11. I'll be sending out a Zoom invitation shortly with that information. This is going to kick off our, I believe, monthly meeting to touch base about this work. And to kind of start brainstorming about the work plan that we've got laid out for year one and some of the subsequent years as well. So stay tuned on that. That is forthcoming. April 29th and 30th, this is going to be kind of the culmination of our two first sessions. It'll be our first, our full in-person systems convening at the GSU Law School. We're going to be joined with the other priority topics of SPAN, so physical activity, ECE, and breastfeeding and nutrition will all come together to kind of go through a 2-day, day and a half session about what we've learned across these two meetings and what where we'll go from there in terms of the systems mapping. So stay tuned for additional details. And if you have any questions, feel free to reach out to me. I'm happy to answer any. And if I don't know the answer, I'm pretty good at finding out. So thanks, everybody. I appreciate your collaboration and your participation today. Thanks for sharing all of your wisdom. And I look forward to seeing you all in person in April and seeing you virtually on the 8th.
Thank you.
Thank you so much.
Everybody. The usual suspects stay on for a quick debrief, please.
I'm staying on just to copy and paste the acronyms, and then I'll leave you alone.
I'll send you a updated packet. I think that would be beneficial for everybody to have. So stay tuned for that too. But yes, please copy and paste away.
Thanks.
Jimmy, I like that there's more than one GSU even.
And I think we can stop the recording, whoever's
Oh, sure.
running it.